Armando Hasurigan, Biology and Medicine videos. Please make sure to subscribe, join the 4-man group for the latest videos. Please visit Facebook, Armando Hasurigan. Please like, and here you can also ask questions, answer questions, and post some interesting things, including your artworks. Here we are going to talk about liver cirrhosis. Cirrhosis is essentially when you have fibrosis, scarring, and liver dysfunction. This can cause a blocked blood flow through the liver, amongst other things, which will essentially result in an abnormal liver function. Liver cells will also die, resulting in the liver to shrink. Cirrhosis cannot be cured and will eventually result in death, unless, of course, transplantation is performed, which is still pretty dangerous. There are many causes of liver cirrhosis. The main one, first, is from alcoholic liver disease, also known or alcohol steatohepatitis. So it's basically when you have long-term, when you drink alcohol for a long time. And this will result in a lot of fat in the liver, which will lead to cirrhosis. An astonishing 10 to 20% of alcoholics will be affected with cirrhosis. It's characterized by steatosis, inflammation, and fibrosis. Aspartate transferase and alanine transferase enzymes, the activities are increased in the plasma, which is not normal. It's supposed to be in the liver. Symptoms of alcoholic fatty liver disease includes fever, hepatomegaly, enlarged liver, and jaundice, yellowing of the skin. Another major cause of liver cirrhosis is non-alcoholic fatty liver disease, or non-alcohol steatohepatitis. This is caused mostly by a bad diet long term. A big contributor for this disease is metabolic syndrome, which is characterized by having 3 of either diabetes, obesity, hypertension, dyslipidemia, and glucose tolerance. It can also be caused by some drugs. It's characterized by steatosis, which is fatty liver, inflammation, hepatitis, and potentially fibrosis. Cirrhosis, liver cirrhosis, takes much longer to develop in non-alcoholic fatty liver disease than in alcoholic fatty liver disease. So we can see why alcohol is very bad for you in this respect. To learn more about these fatty liver disease, I'll provide a link in the description box. Other causes of cirrhosis include hepatitis C virus, but usually for more than 6 months to indicate that it's chronic. This is a virus, hepatitis C virus, that is transmitted. It can be transmitted by from blood to blood contact. It also tends to be asymptomatic for ages, so silent. Acute hepatitis C virus infections can cause hepatitis, inflammation of the liver. Chronic hepatitis C virus infection can cause fibrosis and liver cirrhosis. Now, we would diagnose this hepatitis C virus with hepatitis C virus antibodies, or by detecting hepatitis C virus RNA. We cannot detect the antigen of hepatitis C virus, which makes diagnosis complicated. There is no vaccine against hepatitis C virus, and so to treat this hepatitis C virus infection, we would use interferons, which slows or prevents the progression of the infection. Another cause of cirrhosis that is similar yet different and deadly is hepatitis B virus, and usually the infection has to be more than 6 months to indicate that it's chronic and to progress to cirrhosis. Now, hepatitis B virus is transmitted by blood, sex through semen or vagina. Acute infection is characterized by hepatitis, jaundice, and vomiting. Chronic can cause cirrhosis and even hepatocellular carcinoma, which is cancer of the liver. There is a vaccine available for hepatitis B virus, which is very good to prevent this deadly infection. However, once the infection has occurred, we would diagnose it with hepatitis B surface antigen in the blood and treat it with interferons.